All 170 Children's Miracle Network hospitals are special places, but it's not just the buildings or even the rooms of the clinics that help kids get better. It's the caring doctors and nurses, the equipment technicians, hospital clerks. There are so many compassionate people who work within the walls of these places of healing who make the difference. I want you to meet one doctor who has truly made a difference at the Children's Hospital at St. Francis in Tulsa, Oklahoma. Dr. Dr Nikaidoh is a cardiothoracic surgeon who has literally been fixing broken hearts of children for decades. Dr. Nikaidoh has that extra special gift and is as likable as he is skilled. He is soft-spoken and humble. He is known throughout the world for an advanced surgical procedure that he pioneered, appropriately referred to as the Nikaidoh operation. This procedure has been used to treat countless pediatric heart patients worldwide. Dr. Nikaidoh is just one of thousands of caregivers who help make miracles happen for kids.
I was born in Tokyo, Japan, but I had an interesting background growing up and in the country during the Second World War. Reason why I decided to get into medicine was watching my father practice. He was an obstetrician. He was drafted to military service when his clinic in Tokyo got burned down by a bombing. He survived through it, so he came home. Then he was practicing medicine in a country home. And at that time, I watched my father and even helping him every now and then. And I realized that this is something I could pick up. I decided to become a physician, to be a helper to the ailing people.
He's an amazing man. He's one of the most kind people you'll ever meet. He's internationally renowned, and you would never know it. You just sit and talk to him.
I remember thinking it would just be a miracle if we could get a man like Dr. Nikaidoh to Tulsa, Oklahoma.
As we opened this children's hospital, he brought just a lot of respect and an international reputation with him.
Callie had a heart defect when I was 4.5 months pregnant. The fact that she's a heterotaxy baby with multiple heart defects, we needed a doctor who had experience. I appreciate Dr. Nikaidoh for his honesty. This isn't gonna be easy, and I'll never forget him saying that to me. This is not gonna be easy, Teresa.
He's brilliant. You know, he came up with the Nikaidoh operation. Very much a pioneer.
This super complex transposition with obstruction, left ventricular outflow tract obstruction, we do it this way, we will prevent any more further operations as it's done. 1983, we did 2. The oldest one is driving an 18-wheeler now, and I think the girl is just finished college.
That procedure's been done all over the country.
He has an incredible skill set. He's outstanding in a specialty that it's hard to be outstanding in.
Dr. Nikaidoh, if he calls another hospital, they take his call, where other people haven't had that success. So that's how he got the name Rockstar.
He not only fixes the problem, he also gets everyone around him on the same page.
Dr. Nikaidoh and I have been doing mission work for many years.
And he has a whole team of people, and they go all over the world. He's also done a mission trip where he made wheelchairs for children.
You know, we expected a 5-hour surgery, and it ended up being close to 15 hours. And when he came down the hallway, you know, my husband and I were standing out waiting for her to be wheeled down, and he turned and he looked at us and he said, "I'm so sorry it took so long." Okay, he had been in surgery for 15 hours. What a man of character to look at a family and be so humble to say, "I'm sorry it took so long."
As I was working as a seating specialist for wheelchair delivery in Cuba, somebody suggested that maybe you should take knee pads. So I took knee pad, which helped me a great deal because it is a concrete, gravel, anything, and I may have to kneel down to fix the wheelchair for these people. And then I learned, when you get down on the knees, that is a servant position. And then whatever you do, that you're on the same level as a person who is sitting on the wheelchair. That position is extremely important. And then we should start wearing knee pads in our heart. When I talk to the children, I don't want to standing up and talking down. And in the same way, in our life, if we all get down the same level, and then we never talk from above, handing something down to the other. No, I think it is all a matter of sharing. And when I mentioned that is the president of the Lutheran College says, I have been thinking about which sporting store I should go to get the knee pads.